The liver is one of the most important organs in our body. It performs many functions, such as detoxifying the blood, producing bile, storing glycogen, and regulating hormones. However, many people have some daily habits that can destroy their liver without them knowing about it. So in this video, we will share with you 8 daily habits that can destroy your liver if you don't stop them. Make sure you watch until the end, as you might be surprised by some of them. So let's get started. Number 1. Sleeping too little or too much. Sleep is essential for your overall health and well-being, but it also affects your liver function. Studies have shown that lack of sleep or poor sleep quality can increase inflammation and oxidative stress in the liver, which can impair its ability to detoxify and regenerate. In a study published in 2018, they found that sleeping less than 5 hours per night for 1 week increased the accumulation of fat in the liver and reduced its ability to respond to insulin in healthy young men. On the other hand, sleeping too much can also have negative effects on your liver. A study found that people who slept more than 9 hours per night had a higher risk of developing non-alcoholic fatty liver disease than those who slept 7 to 8 hours. Non-alcoholic fatty liver disease is a condition where excess fat accumulates in the liver cells, which can cause inflammation and scarring over time. According to the National Sleep Foundation, the optimal amount of sleep for most adults is 7 to 9 hours per night. To improve your sleep quality and protect your liver health, you should follow a regular sleep schedule, avoid caffeine and alcohol before bedtime, limit screen time at night, and create a comfortable and dark sleeping environment. Number 2. Eating fast food regularly. Fast food is not only bad for your waistline, but also for your liver. When we eat too much fast food, which is high in fat and carbohydrates, we overload our liver with excess calories and nutrients that it cannot process efficiently. This causes fat to accumulate in the liver cells, leading to non-alcoholic fatty liver disease. According to a recent study from Keck Medicine of USC, eating 20% or more of your daily calories from fast food sources can increase the risk of non-alcoholic fatty liver disease significantly. That means if you eat 1 meal a day at a fast food restaurant, you are putting your liver at risk. The researchers compared the fatty liver measurements of approximately 4,000 adults to their fast food consumption and found that 52% of them consumed fast food. Of this group, 29% consumed 20% or more of their daily calories on fast food. Only this group has a rise in their liver fat levels. Number 3. Not drinking enough water. Water is essential for life and for your liver function. This is because it helps your liver flush out toxins and waste products from your body, as well as maintain the fluid balance in your blood. Dehydration can cause your blood to thicken and slow down the flow of blood to your liver, which can affect its ability to perform its detoxification tasks. Moreover, dehydration can also increase the risk of kidney stones, urinary tract infections, constipation, and other health problems that can put more strain on your liver. A study published in the European Journal of Clinical Nutrition found that higher plain water intake was independently related to lower newly diagnosed non-alcoholic fatty liver disease among males, but not females. The recommended amount of water intake for most adults is about 2 liters or 8 glasses per day, but this may vary depending on your age, weight, activity level, climate, and health conditions. Number 4. Being overweight or obese. Obesity is a major risk factor for non-alcoholic fatty liver disease, which is the condition where excess fat accumulates in the liver and causes inflammation and scarring. Non-alcoholic fatty liver disease can lead to serious complications such as cirrhosis, liver failure, or liver cancer. According to a meta-analysis of 21 studies, obese individuals have a 3.5-fold increased risk of developing non-alcoholic fatty liver disease compared to normal weight individuals. There is also a dose-dependent relationship between body mass index and non-alcoholic fatty liver disease risk, meaning that the higher the BMI, the higher the risk of developing non-alcoholic fatty liver disease. Obesity can cause non-alcoholic fatty liver disease by increasing insulin resistance, which is a condition where the body does not respond properly to the hormone insulin, which helps regulate blood sugar levels and fat metabolism. When insulin resistance occurs, the liver produces more glucose and triglycerides, which are a type of fat, which can accumulate in the liver and cause non-alcoholic fatty liver disease. So how can you stop this from happening? Well, studies show that losing 5 to 10% of your body weight may lower your risk factors for developing fatty liver disease and improve your liver function. Number 5. Drinking too much alcohol. This is probably the most obvious one, but it's also the most common cause of liver damage. You probably already know that alcohol is a toxin that your liver has to process and eliminate from your body. But did you know that consuming too much alcohol can inhibit the breakdown of fats in the liver, causing fat accumulation? This is called alcoholic fatty liver disease, and it's common in heavy drinkers. In fact, it's estimated that up to 90% of people who drink heavily have some form of this condition. The good news is that this condition is reversible if you stop drinking or reduce your intake significantly. However, if you continue to drink excessively, you can develop more serious and irreversible forms of liver damage, such as alcoholic hepatitis and cirrhosis. Alcoholic hepatitis is an inflammation of the liver that can progress to cirrhosis, which is the most severe form of liver disease. Cirrhosis is characterized by excessive liver scarring and eventual liver failure. Cirrhosis can impair the liver's ability to perform its vital functions, such as filtering toxins, producing bile, and regulating blood sugar. It can also increase the risk of developing liver cancer and other complications. Cirrhosis is often fatal, and the only life-saving strategy for patients with end-stage liver disease is a liver transplantation. Number 6. Sitting too much. You probably know that sitting for long periods has been linked to obesity, diabetes, and heart disease. But did you know that it may also increase the risk of developing non-alcoholic fatty liver disease? A recent study from South Korea found that people who spent more than 5 hours a day sitting had up to a 9% increased risk of developing non-alcoholic fatty liver disease compared to people who sat less than 5 hours a day. This increased non-alcoholic fatty liver disease risk remains strong even among those who exercise regularly. That means that even if you hit the gym after work, you may still be at risk if you sit too much during the day. The same study from South Korea suggested that reducing sitting time by 1 hour per day could lower the risk of non-alcoholic fatty liver disease by 15%, which is a huge benefit for such a small change. Number 7. Smoking. Smoking is not only harmful for your lungs, but also for your liver. Cigarette smoke contains thousands of chemicals that can enter your bloodstream and reach your liver. Some of these chemicals can cause oxidative stress, inflammation, DNA damage, and cell death in the liver tissue. Smoking can also worsen the effects of alcohol and other toxins on the liver. A meta-analysis published in Liver International showed that smoking increases the risk of alcoholic liver disease by 55%, non-alcoholic fatty liver disease by 45%, and liver cancer by 51%. Number 8. Taking too much herbal and dietary supplements. You may think that herbal and dietary supplements are harmless or even beneficial for your health. But did you know that they can also cause serious harm to your liver? According to a research review published in the journal Hepatology, 1 in 5 cases of chemical-induced liver damage come from herbal and dietary supplements. A decade ago, less than 1 in 10 cases could be linked to supplements. Some of the herbal and dietary supplements that have been associated with liver injury include anabolic steroids, green tea extract, black cohosh, kava, and many others. The liver injury can range from mild elevation of liver enzymes to acute liver failure and even death. The symptoms of liver injury may include jaundice, abdominal pain, nausea, vomiting, fatigue, and dark urine. So always consult your doctor before taking any herbal or dietary supplement, especially if you have a medical condition or are taking any medication and choose reputable brands that have been tested for quality and purity by independent third-party organizations. So, as you can see, many of us may have these habits without knowing that they can harm our liver and compromise our health. The good news is that you can prevent or reverse the damage by making the simple lifestyle changes we mentioned in the video. So stop these habits today and protect your liver. Let us know what you think in the comments below. Thanks for watching.